Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
First, drugs for open angle glaucoma. In the open angle glaucoma, first line drugs are beta blockers. In the beta blockers, we can use drugs like timolol, betaxolol, levobunolol can be used. Alpha blockers like adrenaline, dipivefrin, then apraclonidine or brimonidine can be used. Prostaglandin analogs like latanoprost are used for open angle glaucoma. Then we have carbonic anhydrase inhibitors like acetazolamide, brinzolamide, and dorzolamide can be used. Whereas miotics like pilocarpine are also used as an carbonic anhydrase inhibitors. Sorry, pilocarpine is a miotic. Pilocarpine is a miotic drug which is used for open angle glaucoma.
thank you and thank you for watching.